appreciate you all spending some time with us. As chiropractors, obviously our goal is to help people live lives without the use of drugs and surgery as much as possible. So one of the things that has been added into our practice is what we call regenerative medicine. And that was not our plan. Okay? That was not what we were looking to do. We're chiropractors first. We're very good at that. We love doing that. And that's our expertise, right? And if we find that people need other things, we want to make sure they get to the right place so that those people with their expertise can help them reach their goals if we can. So the reason why we actually started doing this was because of my mother. Okay. Come on in, guys.
Thank you.
And my mother is a very active lady. She's almost 70 now, but in her mid-60s, she was playing a lot of tennis, and she's a huge gardener. Those are like her two passions. And she ended up hurting her shoulder. She had a partially torn rotator cuff, and it was very limiting to both tennis and gardening. Wasn't really able to do either of them without significant discomfort. And she tried everything. She tried chiropractic, she tried massage therapy, she tried cortisone shots, she tried acupuncture, she tried physical therapy, you name it. All the alternative medicine type of routes that you can go, she did them. And she said, none of this is working. I think I'm going to have the surgery. And I said, Mom, please. From my experience, rotator cuff surgery is one of the most difficult surgeries you can have. The recovery time is 9 to 12 months. The rehab is very significant. And a lot of the times, from polling patients after they've had those procedures, even though the muscle is now healed, people still have the same pain and the same limitation. And I had a very good friend of mine who was doing these types of injections down in Florida. And I said, Mom, fly down to Florida, spend a weekend. He's in Fort Lauderdale, have a nice time, and go get one of these injections. There's no downside. You have nothing to lose. The only thing that possibly can happen is it doesn't work. And she went and had this done. And within 2 weeks, she was pain-free. Back to tennis, back to gardening. I think that was 7 or 8 years ago now. And she was just here today. And I asked her about her shoulder because we were doing this tonight. And she said, I've had no issues. No issues with full strength enough that it's not limiting to her in any capacity for what she's currently doing. I don't think she plays tennis anymore, but she plays pickleball and still has a massive garden that's probably 30 by 60 that she takes care of all summer without limitations. So I said, oh my gosh, this is amazing. Who does this locally that I could start referring people to? And I called sports medicine doctors, and I called orthopedic doctors, and I called a lot of doctors in this area, and no one is doing it. Now, there are doctors that are doing, we're going to call them stem cells, okay? We're not allowed to call them stem cells. They're called mesenchymal signaling cells, but if anyone ever heard me say that, I'd be like, what are you talking about, okay? So for ease of purpose, we're going to call them stem cells. So there are doctors in this area that do stem cells, but they are your own stem cells. So they take them kind of similar to PRP, which is your platelet-rich plasma, which is very similar, where they take the stem cells out of your body and they spin them down, concentrated, and they re-inject them. And we'll talk more about that later, but those types of injections don't work nearly as well as an umbilical cord cell, which is what we've been using. So I found somebody in Chicago, I found my friend in Florida, and then somebody else in the Midwest, and there was South Carolina. Yeah. So at the time, there was very few people doing this. And in New Jersey, we're one of the most highly regulated states in the country. So as I was going through the process of, okay, well, our main goal is still to help people avoid drugs and surgery. And if I can't find anyone else around here that I can refer to, we have to figure out how to be able to help people here to do that. So it took about a year to get all the licensures and issues with lawyers and getting a nurse practitioner and a consulting medical doctor and all that here. But during that time, I was sending people to Florida. There was probably 5 or 6 people during that year or year and a half that it took that flew down to Florida, had the injection done, and came back. And all of them were absolutely thrilled. And now we've been doing this for 5 or 6 years, and the results are incredible. And people are thrilled. I don't think there's anyone who's had a negative experience. There's some people that obviously get better results than others, but it's very dependent on the injury and depends on the individual's goals. Whether or not we make that recommendation of whether or not that would be beneficial. Okay. So that's kind of why we got into doing this. It was that was not the plan, but the bigger goal and the bigger picture of what we do here is really helping people to live their best life, quality of life, not just now, but long term. Right. So does everybody know kind of what stem cells are? So stem cells are cells in your own body that can turn into any other type of cell. They can turn into kidney, they can turn into liver, they can turn into gallbladder, they can turn into muscle and ligament and cartilage, you name it. They're cells that can heal any type of tissue. So that's the great thing about stem cells. But as we get older, obviously the number of that sharply declines. So they are attracted to inflammation. They are attracted to inflammation in your body. So anytime there's any type of injury or there's damage to any type of tissue, there's always inflammation that is present from that. And these cells, these stem cells that are in your body, are attracted to that area, which helps the healing process. Okay, so that's why they are so special, is they are actually attracted to those areas of damaged tissue. Are they safe? Yes, they are very safe. The cells that we use, like I talked about before, are umbilical cord cells, but they are highly tested. I've had many patients who want to know everything that they've been tested for, and I've called and got all of that information. I have it in emails because the amount of things that are tested are way too much for me to even put up here. But they are also from they are harvested before the COVID vaccine. So a lot of people have questions about that, whether or not they have that RNA and that spliced RNA from those injections, which they do not. They're all from before that. And will they work for you? Again, that's on the individual basis. So if anyone has any interest in discussing that with me or Ray individually, we are more than happy to take the time to do that, make a special appointment when we'll sit down and have a discussion regarding what's going on. How chronic is it? Do we need to take some more imaging? Do you have MRIs? All that we'll take into consideration. And the procedure takes 5 minutes. This is not a long-term event. This is not a cortisone injection or an epidural. The needle is smaller than the needle that you would get from either getting blood work done, or if you get a vaccine, the needles are half the size of that. I am not a needle person, period. I mean, I don't do the injections, first of all. We have a nurse that does that. But I've had them done both my shoulder and my knee. I play ice hockey still, to the chagrin of my father and my wife sometimes. But I had torn my meniscus last year playing ice hockey. And I was lucky enough that my nurse was coming that week. I got an MRI, proved that there was a tear, and I had the injection done on my knee. Within 2 weeks, it was totally resolved. And I've also done it on my shoulder, more preventatively from chiropractic, wrestling people all day. I would like to do this for a very long time. So I had them done on my shoulder, not because of an injury, just from a preventative factor. So our belief from a chiropractic perspective is the power that made the body can heal the body. Your body can heal most anything given the right circumstances. That is our belief. And unfortunately, as we get older, that healing potential can become less over time. We can all agree with that, right? But your body's always regenerating, always. Okay, I think it's somewhere 120 days to 240 days. Your entire body replenishes every cell in your body. Now, like your tongue and your digestive system, those cells regenerate very quickly. Like you burn your tongue, right? By a couple of days, it's healed. You burn your hand, maybe it's like a week or so. So there are different cells in your body that regenerate much faster than others. And here are some of the examples, right? Your stomach cells regenerate every 5 days. Your skin cells, 7 to 10 days. Your red blood cells every 4 months. Your liver cells every 5 months. And the entire skeletal system regenerates every 10 years. Okay? So these mesenchymal signaling cells that you're reading about up there, you can see what happens throughout childbirth, the teenager, through adulthood, the massive drop off in the amount of these cells, but not just the amount of cells, the regenerative factor, meaning how fast they repair, also drops off very significantly. So when you're born, 1 in 10,000 of your cells is one of these mesenchymal stem cells. Teenager, 1 in 100,000. But by the time we reach 50, it's 1 in 400,000. So it's a significant drop off in the amount of these cells. So here goes to the process of how often they replicate. So how fast do they regenerate? Again, very quickly when you're young, but very slowly as we get older. Okay, so again, number of cells drops significantly. The regenerative factor of how fast they go from 1 to 2 to 4 to 8 to 16 and so on and so forth also drops significantly. So that is part of the reason why these umbilical cord cells have shown so much greater potential of the healing process, because they're much higher in number and they heal much faster. And they're also massively anti-inflammatory. So I always say the healing process when we're dealing with these injections, about 80% of the healing happens between the weeks 4 and 12. And then about 20% even happens either before that 4-week period of time or after, or a combination of both. Now, there are people who have had these done and say, like, the next day, oh my gosh, I feel so much better. Okay, now, I'm not sure if that's so much, the mental aspect of knowing that they did something to encourage their health and they've got that effect, or if there's actually some benefit right off the bat. Okay,
so something to do with the anti-inflammation.
Correct.
Yeah, your inflammation goes down.
Correct.
Your pain tends to go down.
Correct. So since they are massively anti-inflammatory and create the healing process. So this is kind of what I spoke about before regarding stem cells. Now in the United States, these types of cells are only approved for musculoskeletal complaints. So for joint pain, for torn muscles, for those types of injuries. Yes?
Why do we need approval? Why is this so controlled?
Well, not so much. We're only allowed to do that in the United States. They're approved for experimental use in the United States for musculoskeletal conditions only.
We don't have a downside at all, so why are we controlling something?
Well, I mean, how what road do you want to go down there? FDA is controlled by pharmaceutical companies. So there could be some back channeling there. But if you there is a facility in Tijuana, Mexico, that you can go and have these types of cells done for the Alzheimer's, dementia, heart disease, Meniere's, autism.
Biological use.
No, 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 absolutely not. They're using it for everything under the sun in other countries. Panama has a big clinic also. Yep. Mm-hmm. So they're being used in other countries for a lot of things. Just in the United States, they're more regulated.
Not to interrupt you, but
yeah,
like some autoimmune conditions too. They're doing studies in Europe about like autoimmune how stem cells can affect that as well.
So there is no downside, Walter.
Yeah.
Which is, you're like, well, that doesn't make any sense. If there's no downside, what's the harm? What's the harm? And in my opinion, there is no harm, but for the time
You
being,
said yourself you could go to Florida and get it, so it's a money issue, right?
Yep.
Regulation.
Yep.
regulation.
so I had a friend actually who went in November. He went to the place in Tijuana because he was having some heart issues as well as some musculoskeletal complaints. And he was able to get the injections, but from the more systemic issues, they do IVs.
Yes.
So they were doing IVs there. So
How did he do?
excellent. So far, so good. Yeah. He just went to his cardiologist like 3 months afterwards, and all the damage that he was having is resolved.
Amazing.
Yeah. So he's thrilled. He's thrilled. So this is kind of how regenerative medicine works, right? So you're pretty much the red are the injured building blocks. Those are taken out and they're covered up by the healthy tissue, right? So it's almost like they come in and replace the damaged tissue. So it's not like something that's just looking at taking away a symptom. It's actually working at healing damaged tissue. So like for somebody who has a fully torn rotator cuff, this is not going to be beneficial to them, right? It's not going to take the two pieces of muscle and pull them back together and reconnect them, right? But if there's some tearing or there's fraying of that muscle tissue, those cells will come in and almost fill the gap in between the area that's not damaged and the area that is damaged. My friend in Florida, specifically, who I sent my mother to, is a chiropractor who had a very bad lower back injury issue working on his patients. And he has a before MRI with a bad disc issue, injection of these cells, and a post MRI of no disc issue. Healed. So he has a pre and a post MRI of before and after, which is really neat. Yes. So you can get these types of cells from 3 different areas, which we talked about. So the adipose tissue is a majority of what most doctors in this area are doing. They're going in and they're taking the fat cells most of the time out of the glutes. They're taking those stem cells, they are spinning them down similar to the PRP, and they are re-injecting the concentrated version of the stem cell in the area of injury. And from our experience, and if you do look at some of the research, they're kind of like a 50-50. Sometimes they work, sometimes they don't work. Sometimes they work, sometimes they don't work. The other place you can get them is from your bone marrow. I don't recommend that. That is very painful, where they actually have to put a giant needle into your bones and pull them out. Some doctors do that, but it's very uncomfortable. It's not, and those cells don't seem to be any different in their potential than the cells that you get from your fat in your glutes. The cells that we use they're called Wharton's jelly, mesenchymal signaling cells, where they take the inner part of the umbilical cord. Now, these are full-term pregnancies, so you take that whole issue out of the situation. Full-term pregnancies, and the mothers are asked if they'd like to donate their umbilical cord. Full-term C-section babies. We actually, for all 3 of our children, we donated the umbilical cord. They asked, so like, well, we're not keeping it. We'd love for it to be used for some sort of good. And unbeknownst that this was some possibility at the time, but we donated them all, and hopefully they were used for some sort of scientific research or some sort of good. So that's where they get these cells from, the inner part of the umbilical cord. They're taken out, they are processed, they are cleaned, they are tested for everything under the sun. They are then frozen on nitrogen. So when they are shipped to us, they come on dry ice, frozen nitrogen, and we keep them here in a nitrogen tank. So we don't have to worry about the electricity going out or something being thawed or anything like that. And then we take them out about 5 minutes before the injection. Our nurse warms them up in her hand, gets them to room temperature, and it is literally 1 cc of material, which is about that much. It's remarkable the amount that is used and the benefit that is created. So here it's kind of like a whole bunch of things that you don't have to understand, okay? But what they are is what's in each one of those different cell types. The umbilical cord matrix is what we use in our practice. So you get the mesenchymal signaling cells, you get the cytokines, which are anti-inflammatories, the other cytokines, lots of growth factor, and cytokines are things that will help your body heal and are massively anti-inflammatory. So you can see the umbilical cord matrix obviously has the largest amount. Hyaluronic acid you might be familiar with. A lot of people will use that for joint pain. They do that. That's actually approved by Medicare now for knee joint injections. It kind of helps to help the cartilage heal in the knee specifically. So right now there's more than 4,000 clinical trials going on in the United States regarding stem cells. Actually had a patient whose wife is having some early signs of dementia, and she was able to go and participate in a study in Chicago, I think it was, where she was able to get some stem cells injected in around her brain. So there is some more research that's being done here in the United States as well, which is wonderful. We'll see what happens. Hopefully it becomes much more available and much more able to be used on a regular basis. Unfortunately, again, it's very limited of what we can do and how we can even talk about it. And you can't market it. You can't say you do all these things. You can just say, we do regenerative medicine, which is like, well, that's really broad. So that's kind of why we started doing these little lectures, helping people understand a little bit more about it and how it might be beneficial to them. These are some of the things that we've helped some of our own clients with. The number one joint that we get the best results with is the shoulder because it's non-weight bearing and you can minimize your use in that area for a period of time. Okay. Rather than your knees, your hips, your lower back, right? Those all weight bearing, dealing with that. And the elbow also does very well. Probably the second best results we get is the lower back. The knee is the most difficult because of the weight bearing and the joint and the pressure that's put on there. Now, if we told people like go stay in bed for 6 to 8 weeks after a knee injection, it might get better results faster, but they're going to end up with a lot of other problems because you shouldn't be sedentary for 6 to 8 weeks. You'd have to go through a whole process of rehabilitation. But the knee does respond. It just usually takes a little bit longer than the 4 to 12 weeks, which is a majority of what we saw people get healing response to.
What about neck?
Neck, we've done a few necks. Now, we've had some good results with neck as well. When you're dealing with the spine and other joints, obviously we're not doing like spinal injections here because that has to be very specific. That has to be very like under guidance of ultrasound because when you're dealing with nerves, you don't want to hit a nerve with a needle. Okay. But with these cells, all you have to do is get them in the vicinity of the area because of the way that they're attracted to inflammation. So like as a cortisone shot or epidural, if you don't get that medicine in the exact spot that's creating the symptom, there's really no benefit. There's no relief. With these cells, if you get the injection near the vicinity of the area, they will travel to the area that's damaged, which is great. And the story I tell about that is we had a patient who had very chronic lower back pain, was considering surgery. And I said, hey, well, before you go down that road, let's try this. And he said, okay, I have no problem with that. Let's do my back. And if I get great results, I've had this chronic shoulder injury since I was in high school playing soccer goalie that I've had. And if my back does better, I'll do one on my shoulder as well. So he had his back done. And 8 weeks later, guess what? His shoulder felt better too. He had a partial tear. Yeah, of his labrum. So, yes,
You were saying that knee takes longer to.
not in all instances, but a majority, the knee tends, from our experience of doing the knee injections, the knee tends to take a little bit longer to heal than the other joints.
Because of the fact that we can weight on it?
Because of the weight bearing, all the other there's so many structures in your knee. You've got your two meniscuses, and you have your ACL and your MCL and your PCL and your LCL. So there's a lot of other structures there. So people still get results, but it tends to take a little bit longer for them to notice the symptomatic change. Like one lady I can think of now, she didn't really have any change until about 6 months. And then at 6 months, she called me. She was actually someone that flew here from Iowa, I think. Her niece lived around here and had this done, and flew her aunt here. And she called me like 6 months later, and she's like, I just woke up one day and I noticed I don't have knee pain anymore. It had been like even a few weeks.
How long was she?
And she didn't even realize that her knee didn't bother her anymore, because she had given up, like, oh, I guess it didn't work for me, because it was like 6 months later that it finally, whatever the healing process took for her, it just took longer. So these are the most common things: golfer's elbow, tennis elbow, torn meniscus, rotator cuffs, labral tears, minimal cartilage in joints, and things like that. If your joints are bone on bone, I usually don't recommend these types of injections, because it's not growing the cartilage back to the significance that it's going to keep you from possibly having that surgery. But if there's a good joint space there, but you're having a lot of discomfort, the likelihood of it benefiting you is significant. I'd say it's somewhere between 80 and 90%, depending on the individual, depending on the severity of the symptoms, depending on the chronicity of the symptoms, and all the other things that we discuss. I always say there's no downside. The only contraindication to this type of injection is cancer diagnosis within the past 5 years. Okay, it might be 3 years now. I think they might have changed that about a year ago. Because cancer, right, there's usually a significant growth of abnormal cells. So putting in some sort of stem cell that's going to encourage more growth, obviously, you don't want to do that. So that's the only contraindication to injection. That's the only downside. Okay. So here is the whole process of collection from the mother to the birth, the collection, the cleaning, processing, cryo storage, quarantine, release, ship, patient. Okay. It's like that whole process is very organized. It's very clean. It's very professional. We have a representative who takes care of everything. We have somebody who comes and fills our nitrogen tank every 2 months, so it never runs out of nitrogen. So it's something that's always being taken care of and very safe. I wouldn't be doing it on myself. I wouldn't be encouraging my family members to go down these routes. We never encourage someone to do something that we haven't either individually used or someone that we love and care about has had a great benefit to it. So we are never going to tell a patient to do something we haven't tried or done ourselves. Okay. So they are FDA approved, again, experimental use right now. Hopefully that FDA use will expand in years to come. The results can last indefinitely. Most of the time, this is a one and done injection. The only time we've done more than one was somebody who was really trying to avoid hip replacement. And it was kind of bone on bone at the time when we did the first injection. And she said, I don't care. Let's try it. What do I have to lose? It's just money. She did it once, didn't really benefit. Did it again, didn't really benefit. She ended up having the hip replacement. So that's the only time I think we've ever done more than one. So insurance does not cover these injections, considered they're experimental. They should. I wish they would, but they don't. It's similar to PRP. They don't cover experimental or things that actually work at promoting healing and regeneration. We're really focused on symptomatic relief, not correction. There again, no negative side effects. The 2 times I've had these done, the injection site, I've never had any soreness or tightness or discomfort afterward. Again, I'm not a needle guy. Like you walk in, it's a 5-minute, you meet with the nurse, everything's already taken care of ahead of time. We send all of your imaging to the nurse and the consulting medical doctor to make sure that they have no questions, which they never do. And then you walk out and there's no limitation afterward. The only 2 limitations that we really encourage people to do is to try to minimize alcohol and sugar intake afterward, because of the systemic inflammation that both of those things create within your body and in your gut. So both alcohol and sugar are major inflammatories to our body. So if we do an injection in an area, we want those cells to stay in that area as much as possible and not travel to your gut. So we encourage people to limit alcohol and sugar intake for the first 2 to 4 weeks. And the other thing is, we encourage people not to take any anti-inflammatories for the first couple weeks after injection, because we want those areas that are injured and damaged to be inflamed, because these cells are attracted to inflammation.
Would that include like fish oils, things like that?
Not so much that, just like more the medication type of anti-inflammatories, because those have minimal effect. Success is determined by the individual, right? That's going to be my first question to you if we were to sit down, is what does success mean to you, right? Is it based on a pain scale? Is it based on an ability to do something that you haven't been able to do? For my mom, it was get back to tennis and gardening. She could deal with a little bit of pain. I wasn't looking for it to be amazing, like 100%. She still has some tightness and stiffness, but it's not limiting anymore. So if people are at a pain scale of 7 to 8 and they're looking like, I want no pain at all ever again, probably not the thing for them, right? But if they're on a pain scale of like a 4 to 5 or a 6 to a 7, they want to get to like a 1 or a 2 so they can get back to doing the things they love to do, and if their pain was a 1 or a 2, they could do all those things. Then that's a really good place. That's a very good goal and a much more achievable goal long term. So yes, Walter.
What's the cost range?
Cost is $3,000.
I'm sorry?
Cost is $3,000.
No matter.
One injection.
Okay.
But that's the injection, but if you have to get
That
X-rays or MRIs or something, that's pretty expensive.
It depends. It depends. Obviously, everything is dependent on what. Well, insurance will cover like MRIs and imaging and things like that. Insurance won't cover the injection. So.
But you, because I know you do some X-rays.
We do X-rays here.
But not MRIs.
Yep. We don't do MRIs here. But if there is something that we would think would be beneficial for an imaging, then we can obviously send out for imaging or get your GP to send you for imaging for your MRIs.
And the MRI place in Warren has I found that to be a lot more
Cost effective.
cost effective. That one
Yep.
in Warren.
What's it called, the one in Warren?
University Radiology. But they have a bunch of them, but the Warren one I got the best price from, and I think I paid $600 for my MRI, and I can't remember how much it was, but it was a piece of it. Something in that.
So you could just go in and get it
No,
done.
you have to get a prescription.
We can give you a prescription, and Harding Radiology down the street does it for $425
Oh, really?
Yeah.
Don't tell my husband.
for any MRI without contrast, which is you don't need contrast. You had contrast, so maybe that's why it was more expensive. So they'll do it for $425 out of pocket. Now, again, if you have the insurance and you want to go through that and get the approval, then that's a possibility as well.
That's a forever story.
It can be. It can be.
Insurance company.
It can be. But yes, there is an imaging center 2 minutes down the road that can do that if we feel like that's necessary. Okay. So, does anybody have any other questions?
Yeah, when can I get mine, Jeff?
What about the Alzheimer's piece? Where would you put it?
Yeah, exactly. So if you're interested in like sitting down with one of us and talking more in depth about what's going on with you, and we can talk about when your last imaging was and if we should do some new imaging and so on and so forth, let us know. We'll sit down, sit with you 15 minutes to half an hour and go through a little exam, discuss your individual case, and take it from there. And if any questions come up in the meantime, we're very available and we'd be happy to answer anything you may have. Yeah, absolutely.
Well, thank you very much.
Absolutely. Thanks for joining us and learning a little bit more about what we do. Oh, good. All right.